I'm Miller Thornberry. I'm one of the doctors with Hunt Country Equine. We're an ambulatory practice that works out of the Tryon area. Today I'm going to be talking to you all about equine dental anatomy, the oral examination, and routine dental float. This is an equine skull, and the first thing to recognize about horses is that they have what are called hypsodont teeth, meaning that their teeth erupt continuously throughout their lifespan. So as they grind their food, the occlusal surface of the crown wears away. So on the skull, what you see here is the clinical crown. What you don't see is the reserve crown, or part of the tooth that is up recessed within the bone, and then the root of the tooth. As they grind their feed and that occlusal surface of the clinical crown wears away, the tooth continues to erupt, and the reserve crown gets shorter and shorter and shorter throughout their life. So a young horse is going to have a quite long tooth, and then by the time they're in their 20s and into their 30s, the overall length of the tooth is going to be quite short. This is some of the equipment we use for the dental exam and float. What we have here are hand floats, mouth rinse, and then water to actually rinse out the mouth and the feed material prior to the exam. We often use a mirror to actually look at the occlusal surfaces and the sides of the teeth. This is a periodontal probe that allows us to assess periodontal disease if present, and then a dental pick to actually look at the occlusal surfaces and assess the integrity of the enamel and the dentin and the cementin, the surfaces of the teeth. And then for the routine part of the float, this is a dental power float with an oscillating disc. And so this is how we're going to correct any occlusal abnormalities and take off those sharp enamel points. We also use a combination of sedatives to sedate and relax the horse, a headstand, and a dental speculum, and then a good headlamp or light source.
Dr. Thornberry, I'm wondering at what point, how do you decide whether you're going to use the hand tools or your power tool?
We try to use the power tool because we can be more precise with correcting abnormalities in the mouth. We do kind of use the hand tools as needed. If a horse has really, if they've got hooks, if their upper jaw is kind of set forward with their lower jaw, they tend to develop these little hooks or potentially ramps on their last molar. So the hand tools are nice to be able to get back there where it's difficult to get the power tool, so you can correct those. Oftentimes we'll use the power tools on the incisors if they have issues with those. They tend to respond well to the use of the hand tools in that situation. And then if a horse is just averse to us using the power tool, or there's an owner preference, then we'll use the hand tools in those situations. But in general, the power float is much more of a precise tool, and then we can do the exam quicker. They don't have the speculum on as long. It's easier on everybody. This is Seamus. He's a 5-year-old quarter horse gelding, and he's going to be the horse that we do a dental on today. So the first thing that we like to do before we actually do anything else is just a brief physical exam. So we'll actually just look at their head, make sure that they don't have any hypertrophy or atrophy of the muscles of the face, make sure that their lymph nodes aren't enlarged anywhere, and then make sure they don't have any nasal discharge. And then we'll just look at their gums, make sure they're nice and pink, make sure they have a good capillary refill time. And then we'll listen to their heart, their GI tract, and take their temperature to make sure that they're healthy to be sedated. Once we have assessed their heart, made sure that they don't have any arrhythmias or murmurs, and are comfortable that they're healthy to be sedated, we'll give them a sedative in the vein of their neck to help them relax for the dental procedure. Okay. Yeah, no, let's do it. So once the horse is nice and sedate, we're gonna put them up on the headstand and look at their incisors before we put the mouth speculum on. And so this is a 5-year-old individual. You can see his incisors are wearing appropriately. He has just a slight overbite. And then you can see his canine teeth coming in. He's got his bottom canine teeth and the top are actually just erupting, but everything looks good. Once we've floated all the arcades, I go back over and just make sure everything feels like I'd like it to feel. Make sure those points are adequately removed. And then with Seamus, because he is 5, we are looking for things like retained deciduous teeth. But at five, that process is pretty much complete. And he's got all of his permanent premolars in and in wear, so everything looks good. His mouth looks great. If we do this yearly throughout his life, it'll really improve the quality of his life, and then just his overall longevity.